Good evening, everyone. My name is Jay Feinberg, and I'm Gift of Life's founder and CEO. It is my great pleasure to welcome you to Gift of Life's Texas Town Hall, addressing healthcare disparities in our communities. I'd like to thank our organizing partner, the NAACP, and our sponsors, Morgan Stanley, Fidelity Investments, the McKesson Corporation, and Rubius Therapeutics for their tremendous support. Today's topic could not be more timely or important. We have watched as COVID 19 has spread throughout the United States, leaving a trail of human destruction in its wake. And we have been reminded of the inequities that permeate healthcare, resulting in unequal outcomes for people of color. These disparities extend far beyond our mission to provide a cure for those battling diseases like blood cancer, immunodeficiencies, and sickle cell. But as part of our mission to create equal healthcare opportunities for everyone, we are compelled to take action addressing not only this, but the larger issue that the pandemic has further exposed. My personal story began in the early 1990s when I was diagnosed with leukemia. Naturally, I was devastated, but relieved to learn that a bone marrow transplant could save my life. First, though, I would need to find a matching bone marrow donor. It wasn't until I met with a transplant physician in New York that I was told I would never find a match because of my Jewish genetic heritage. I had absolutely no idea that tissue type is inherited, like the color of our eyes or our hair. So the best chance of finding a genetic match lies with people of similar race and ethnicity. Unfortunately, the donor registry was not ethnically and racially diverse, likening the search to looking for a needle in a haystack. Thankfully, with a lot of hard work and a 4 year high profile grassroots campaign, I found my match. Now it's my life's mission to pay it forward. Every patient deserves an equal opportunity to benefit from the treatment that can save their life. The registry must be representative of people of all backgrounds. To help give voice to this message and encourage others to join in the fight against blood diseases, Gift of Life has launched a new short film in collaboration with rapper and lyricist Terrell Trizzy Miles, with creative support from the Lucy Collective and The Mill. And now, allow me to introduce Blood is Thicker.
So Terrell, what made you want to write this, bro?
Because blood is thicker than water, like fathers.
Mothers, sons, and daughters. But what if I told you the blood relation can go farther than the people you know? You have the power to save a life with a simple swab of the cheek. That's all you need to make someone else's life complete. For those like me, or from a different creed, no matter what you look like, there's someone out there who you can be. A hero to, a vessel of new life. Someone who can bring them light when the road seems weak. For those who seek bone marrow or stem cells, through this one gesture, they will be allowed to prevail and tell the tale of how one small act managed to break the scale, and their life was allowed to once again set sail to heights unknown, to love once more. The gift of life, from my family to yours.
Absolutely incredible. Terrell, if you're listening, you are so incredibly talented. The film you just saw, Blood is Thicker, is one of the initiatives we've put in place to educate communities on these very important issues. This town hall is another. And so, in partnership with the NAACP and Dynamic Changemakers, we are pleased to have you join us for this one of many meaningful conversations about ensuring that Black, Indigenous, and people of color have safe, effective, and full access to healthcare and life saving treatments. And now it gives me great pleasure to welcome today's moderator, editor in chief of the online magazine The Root, Danielle Belton.
Thank you, Jay, and good evening, everyone. Apologies for being muted. I'm Danielle Belton. On behalf of Gift of Life Marrow Registry, we're excited to gather today to discuss the pressing issues surrounding health disparities and how we can all play a role in solutions to affect lasting impact. The coronavirus pandemic and recent racial turmoil have brought racial healthcare inequality to the forefront of the national news and into everyone's awareness. The US accounts for more than 8 million COVID 19 cases, and the death toll from the coronavirus has topped more than 220,000. 220,000. Black, Latino, and Indigenous people all across the country and in every age group, including young people, have been disproportionately affected by the coronavirus. They're more likely to be diagnosed with the virus, more likely to suffer serious illness, and more likely to be hospitalized because of the virus, and more likely to die from it. The numbers and data points highlight the underlying and long-standing healthcare inequalities that have existed in our country, particularly in Black and other communities of color. These enduring health disparities have been fueled by decades of discrimination, mistrust of the healthcare system, unequal treatment, unequal opportunities for economic, physical, and emotional health, and other issues that limit access to quality care. As a result, the health and wellness of people in minority communities is often shaped by a deadly cycle of chronic disease and loss of life, a cycle that continues through generations, a cycle that devastates families and communities. These challenges remind us that the barriers to health are interconnected and the problem is bigger than any one disease or chronic health condition. But here's the biggest challenge. Many people believe that they're unable to take action because solutions often overwhelm instead of inspire. As you've already heard from Jay, changing health outcomes is possible. Through action, Jay was able to turn a moment of crisis into one of transformation. You'll hear from more people shortly who agree and are working to overcome healthcare disparities. We will explore how advocacy, partnerships, and youth led efforts can serve as a powerful catalyst towards building and sustaining healthy and equitable communities through the discussion with our esteemed panelists, Dr. Linda Chin, a renowned physician and researcher who uses technology to improve access to healthcare, Andre Harris, a social worker and PhD student who also is a sickle cell patient and advocate, and Dr. Jonathan Shepard, a physician and board certified child, adolescent, and adult psychiatrist. Lastly, we will speak with Siobhan Steuben, who, as the NAACP Florida State Conference Youth and College President, is working with the Youth and College Division of the NAACP across the country in support of this program. Not only are youth proving to be catalysts and prolific communicators in social movements, but we believe their involvement is key in creating healthier communities. We invite you to submit your questions in the chat for a brief Q&A with our experts at the end of the program. So let's welcome our panelists. Welcome Dr. Linda Chin, Dr. Jonathan Shepard, and Andre Harris. Thank you all for joining us.
Thank you for having us.
My first question is for Dr. Chin. From your perspective as a physician, how has the COVID-19 pandemic served as a tipping point for disparities in communities of color? And what are the lessons we can learn from it?
Thank you for inviting me to speak here. This is a passion of mine to study this area. I think COVID-19 have really shown a bright light on the flaws of our healthcare system and particularly the disparity. I think the system was very much built around the providers, is what we call provider-centered system. That means unless you have providers that are equally spaced across the country, there is disparity in distance to accessing these care providers. And that distance and the resource it takes one to overcome that distance to get to their provider present a barrier. And that is a foundational piece that sort of drives a lot of the disparity. And with the COVID, it really have exacerbated and let everyone sort of be aware of how challenging that is. So I think the COVID, it really is the tip of the iceberg shining a light on the situation that we have seen. What I want to really highlight is we often think a lot about disparity due to bias and also social determinants of health. And social determinants of health are social needs or lack of or a certain resource that present and sort of lead to suboptimal outcome of the patient seeking cares. And that includes, food insecurity or housing insecurity, lack of transportation, etc. But I think in addition to social determinants of health that creates a barrier to accessing care, we often forget that there is what I call a practice gap. In other words, the availability of resource. And in fact, Jay's story talk about it. If the resource is not there, if the registry doesn't have the diversity to accommodate for all the patients, then you lack that resource to be able to identify an appropriate donor. So in cancer, which is the area I worked in, is even more challenging because there are a more significant shortage of cancer specialists, particularly in underserved community, in rural community. So addressing the inequality in accessing cancer care, both prevention and treatment, have a lot to do also with having available cancer experts and not just enough of the cancer specialists to serve the community, but also cancer specialists that have access to specialty care, where academic cancer centers and how far away those cancer centers are located. All of that create a significant challenge for people of colors, the underserved community, and the rural community to get care in a timely fashions. So I think when COVID hit, the fact that cancer patients are not able to continue their treatments or their participation in trial or even going for screening, it's going to lead to significant long-term sequelae that we will be dealing with beyond the COVID pandemic itself.
Now, Dr. Chen, you're someone who uses technology to improve access and affordability of quality healthcare in Texas and beyond. How are you working with oncologists and other providers to deliver best-in-class care for patients in underserved areas?
Great question. I think technology can be the equalizer. And we already seen it during the COVID pandemic, the adoptions of virtual care and telemedicine tools that can help patients connect with their physicians so that care can be delivered remotely, and the adoptions of truly patient-centered care. In other words, the care going to the patient rather than our traditional expectations of patient coming to the hospital. In terms of our focus is the next step. If we think about the technology connecting patients and physicians 24/7, just like your social media or your cable TV, you're connected. The next question that we have to ask is, do we have the right expert on the other end of that telephone line who can answer the question, who can give the right care? In other words, now we have to think about how to apply technology to capture the knowledge and experience and expertise of a particular field in medicine, so that the patient on the other side at home connecting with the doctor remotely, but are actually getting the right doctor and the doctor with the right expertise to address their problem. And that obviously is a situation in cancer, because cancer is a specialty in medicines, and the oncologists are specialists, and relatively, speaking, we are particularly, outside of the urban area, a big urban city, we have a shortage of trained oncologists. And then when you look at you probably have heard great advance in cancer in the last decades, where we have come a long way from diagnosing cancer based on which part of the body is being affected. In other words, you have a lung cancer or you have a breast cancer. We have now gotten to the point of being able to define molecularly what the mutation is that's driving the cancer. And therefore, we have the ability to provide very smart medicine that target the cancer rather than, you know, a bomb that create a lot of collateral damage and hurt the other body part organ system. So that kind of smart medicine now require access, and not just the patients, the ability to access and afford these diagnostic tests and these new medicine, but also the oncologists and their care team being trained to know how to use this latest and best diagnostic tests and medicines. And, you know, and the latest advance in cancer is the immuno-oncology, the advance of this new class of medicine that awaits your body's own immune system to fight cancer. That whole new class of medicine didn't exist, was not approved until less than 10 years ago. So now almost 50% of the cancer patient population would have a option to use this class of medicine based on the FDA's approval. But now what that means is, unless your oncologists were trained in the last 10 years, they were never given the chance to learn about this class of medicine and gain experience in terms of how to use this medicine, because every medicine has potential side effect that the clinician need to know about and anticipate and be able to manage that. So that's an example of what I call practice gap. In other words, you may have access to an oncologist, but you may not have an access to the oncologist at the regional cancer center who is a specialist, subspecialist, who have experience with this new class of medicine that was just approved a year ago. And that, you know, further exacerbate the disparity. Now, technology comes in because in addition to giving you that virtual connections, technology such as artificial intelligence and machine learning can capture the knowledge and the experience of these specialists so that it becomes a virtual advisor that can provide that virtual support to your local team, and bridging the gap in the practice level of experience for subspecialty. And that way we can lift the boat and maximize the ability of the broader population to access healthcare provider that can deliver the latest and best medicine. So I think to the questions, I think technology is going to be the equalizer, but we have to remember that technology is not one size fits all. We need the technology to connect, but we also need the next level of technology that also capture the expertise, because we need to close that practice gap in terms of having practitioners that are trained and experienced in the latest advance in a field of medicine.
Thank you. My next question is for Andre Harris. As a sickle cell patient and advocate, what do you think needs to be done to build a more equitable health system for people with a blood disease like sickle cell, which needs to be constantly managed?
That is a loaded question. And in order to succinctly answer, I think the biggest thing that can be done in order to advance or increase health equity for sickle cell patients is to be able to make sure that the sickle cell population has appropriate access to healthcare insurance. Insurance is probably one of the largest or biggest reasons that is a barrier to care for sickle cell. And they are not able to access the services and the care that they need simply because they don't have the appropriate insurance. So I think it's very important for us to be able to find ways to get sickle cell patients covered under insurance, whatever that. Also, just like Dr. Chin said, I am a social worker, and I am also earning my PhD in social work. And one thing that we talk about in social work is the social determinants of health. And not only is insurance a big one, but allowing allowing people to have access to transportation and housing. These type of supportive wraparound services are one of the biggest ways to support health equity, specifically for someone who has sickle cell disease, which is lifelong and which is chronic. If a person has a doctor that is a wonderful physician who is, fellowship trained and who practices at a comprehensive sickle cell center that is world renowned, but they don't have the transportation to attend their appointments, then whatever treatment that world-renowned physician is offering them, whatever treatment plan that they are being offered cannot be very effective because they can't access it. So being able to find different ways and innovative ways to bring health equity to everyone is what we need to do in order to see that, especially in the sickle cell population.
Oh, that makes a lot of sense. So, Andre, for many sickle cell patients, a bone marrow or stem cell transplant is the key to a cure, but the lack of diversity in the global registries is a major hurdle. What message do you have for Black people in particular who are hesitant about joining the registry?
Again, this is another loaded question that I get a lot of times, and I think I'm always the one who I am okay with talking about the uncomfortable things. But I think because of the historical mistrust, and let me back up and do a preface. For those watching, if you don't know, sickle cell disease is not a Black disease. But in this country, it has always been assumed to be one. Sickle cell disease is purely a genetic disorder that anyone can inherit from their parents, Black, white, red, yellow, purple. So with that being laid as a groundwork, um, our country has really framed sickle cell disease from a Black disease perspective. And I say that because a lot of people in the Black community have historical mistrust due to Henrietta Lacks, a woman whose um, uh, genetic information was used years after she even passed away without her permission. It's now a movie, all of, a book, because of the Tuskegee experiment. These are things that we talk about ad nauseum in the sickle cell community and the rare disease community. I'm also a huge clinical trial advocate. We talk about that in those spaces ad nauseum, because the mistrust is something that we have to tackle. And again, as a social worker, someone who's trained as a social worker, I think in order to tackle that hurdle and that obstacle, we have to educate our communities about the mistrust. Can't ignore the elephant in the room. We can't act like it never happened. We can't lie and say it never happened. These things, Henrietta Lacks, Tuskegee, and there's countless other incidences, but those are probably the most two famous. But if we don't talk about them like they never happened, this is how the mistrust continues to perpetuate generations and generations to come. And so I think in order to address that, we have to find some ways to educate the Black communities and also other communities of color about what happened, and honestly how now we're more protected because of what happened. We see informed consent was birthed because of Tuskegee. We see that informed consent and other IRB, mandates were birthed out of Henrietta Lacks. These type of injustices that were faced in the Black communities and communities of color are now the reason why in 2020 we are more protected than we have ever been. And so if we educate, excuse me, if we educate our communities about these issues, I think it would greatly change how communities of color view being on registries, participating in clinical trials, donating blood, all of these things that our communities normally don't turn out to do. I think once we educate and then let them know that there are safeguards in place, that it will be a lot harder for someone to take advantage of you now. And if they do, there are repercussions that they will have to face. I think this will help that issue.
Yeah, I definitely agree with you, Andre. I really feel like conversation around these issues and the fears that people have and acknowledging them are really key to getting over this particular, stigma people have about seeking help here. My next question is for Dr. Jonathan Shepard. Much like with sickle cell and the coronavirus, Black people are disproportionately weighed down by the heavy burdens of stress. COVID-19 is not only causing higher death tolls among Black and Brown people, but it is heavily impacting our emotional well being. How can people be encouraged to seek mental health help?
Well, I just want to first just say greetings and thank you, Danielle, for moderating, and thank you for Gift of Life for having me be a part of this panel, and thank you to the other presenters. This question is one that really bears hearing a profound answer and a direct answer. How do we encourage people to seek help? Help is needed. I'll just start there. Help is needed. Help is needed right now, and we need it immediately because we are in the midst of a dual pandemic. The COVID-19 pandemic has struck, and we've already heard about how it has shown light on the healthcare disparities. We've shown how it has brought to light so much information that really was already there. It's just that some of us have buried our face in it. And so what we need to do to encourage people is to let them know, first of all, what you are experiencing is normal. If I had people around me, I would ask them to just repeat after me and say, this is normal. It is normal to be distressed when we are facing situations that we do not understand. And so one of the things that I like to stress to people is that distress or stress is normal and it is okay. So that's, first of all, we have to normalize it and tell people that it is okay to be distressed. The issue, though, is that people should not stay distressed to when they become disordered. So if you could think about a continuum, like a line, like a journey, everyone will experience distress. And so how do we encourage people to seek help? We have to let them know it's okay that you're feeling anxious. It's okay that you're feeling down right now. Because we are facing challenges, it bears repeating, that we have never seen before. But if you stay distressed for too long, you will then become disordered. And that's where so many of us find ourselves right now. Disorder means that you're unable to function properly. And so what I encourage those who are listening and watching this, if you find yourself and you find yourself or find someone in your family or in your circle of influence who is not functioning properly, that is the time to seek out help. We have so many people who are not functioning properly right now. How do you know that, Dr. Shepard? Well, I've looked at, I've studied, I've read it, I've seen the surveys, but I don't even have to look at that. I could just look at how people are conducting their day-to-day business. People are scared to go outside. Once they go outside, they don't want you to cough or sneeze nowhere near them. Otherwise, they will literally run for cover. People are irritated. People are angry. These are the things that I am seeing within our population right now. And so, again, I stress during this time, it is okay to feel what you're feeling. It is okay to be distressed. It is not okay to be disordered. And so as we go through this pandemic, you need to check yourself to say, hey, am I now not functioning properly? And so I encourage you, this platform that we are having today is another way that you can check yourself to see, are you okay? So it's platforms like this, it's being able to read and study and then you need to be around people who know you, who will let you know, hey man, you're not doing okay. Hey girl, I think something's off. We need to have people around us who we trust, who will let us know that, hey, we need some help. And so those are just some of the tidbits that I would leave with you all today.
No, that was really helpful. I especially like the part where you started talking about how we kind of approach this issue with our loved ones, which goes really well into my next question, which is how can an individual help a friend or a loved one who they recognize need mental health support? Like, what's a way that we can approach them to help them get the help that they need?
Absolutely. Well, we have to approach it with sensitivity. The sensitivity is definitely what is needed when you're dealing with mental health issues. It's not a joke. It's not funny. And again, I know some people like to use humor, which is a mature self-defense, but with sensitivity, when you recognize that something is off in someone, you need to say something. We see these billboards all the time. If you see something, say something. This is not the time to be quiet. This is not the time to be silent. There are so many people who are suffering in silence. Let me just take it a little step further. The Black community loves to suffer in silence when it comes to mental health issues. And I understand why that is. Mr. Andre Harris just talked a little bit about that because we have a distrust with the medical community. You must remember too, that there are only 5% of physicians who are Black in the United States of America. 5%. 5%. That bears worth emphasizing. Even though we're 14, 15% of the population, 5%. And so we have a mistrust. And so when we recognize that someone is not functioning or disordered, as I talked about earlier, then we need to approach them with sensitivity, with a way of saying, hey, how can I assist? And then you just don't say it and drop them off. You go with them. You must. Now, again, you may not have to go into the session, but at least drive them to the session. At least walk with them. At least show them how to be able to have someone who will support them. To let them know, again, it's okay. I go back to what I said earlier. These things that we are experiencing, mental health challenges, they're not odd. They're not weird. You're not crazy. You are normal. You are experiencing the challenges and the weight of what we have had to endure these last 8 months, which was totally unexpected. And so now we need to surround ourselves with people who can provide that help for us. I will say this last thing. There is a barometer that you must use when you are checking yourself out too. And it's my mantra. And I rarely go anywhere without stating it. It is PCWC. This is the definition of mental health. Mental health is nothing vague. Mental health is not scary. It's not spooky. Mental health is very precise and it's very definite. And it's something that we must adhere to make sure that we are well. First point, potential. That is what mental health looks at. It looks at your potential. Second point, it looks at your ability to cope. Third point, it looks at your ability to work. Fourth point, it looks at your ability to make a contribution to your community. PCWC, your potential, your ability to cope, your ability to work, and your ability to make a contribution to the community. And when you know that one of those four things is off, it is time to seek help.
Very powerful words and so important. I mean, as someone who personally suffers from mental health issues, I couldn't agree more with everything that you said there, Doctor. So I want to pivot to bring in our final guest. Last but certainly not least, I want to welcome Siobhan Steuben. Hi, Siobhan.
Hi, Danielle. How are you?
I'm doing great. Today's conversation is part of a series of town hall conversations taking place virtually on college campuses nationwide. From the NAACP's perspective, what can young people, particularly college students, do to make a difference?
Yeah, I think when it comes to the NAACP, so I'm a recent alumna of Baylor University, and also a previous chapter president of the NAACP for that university as well. And so now I'm the state president for the Youth and College Division. And so what I would tell young people is there's a lot that you can do. Both of our doctors and Andre talked about mental health, COVID, talked about sickle cell. There is so much that we can do, whether it's being sure you're able to check on yourself. When it comes to advocacy, there's so many times where you're considering other people or you're trying so hard to delve in and invest in the work and what it looks like to create change that you have to check on yourself. So that's the first thing I would say. You have to make sure that you're okay. But then in addition, I think as advocates and as activists, we have to start creating more space for conversations around health. Health is a game changer for the NAACP, but around what do we talk about? You know, we are talking about mental health. I think mental health has become a really hot topic in the last couple of years, and I think it's one that we've been more involved in, but we have to continue to talk about it until it's something that isn't as common to have to keep saying it's okay not to be okay. And then when it's around issues as well as like the donor list, I think that's a really big conversation. I like that Andre brought that up because like you said, we have to continue to educate people. Part of being an advocate and being an activist is education. You have to know things before you can go and tell other people. And so you have to be able to take that in and say, okay, like you said, we have safeguards now that say, okay, this happened before, and how do we make sure this is not something that happens again? I used to say history was my least favorite subject because it kept repeating itself. And so we have to remember to say, okay, let's take that history in and make sure that we're actually creating change that's different. So like you said, there isn't and shouldn't be another Henrietta Lacks, another Tuskegee experiment, because we should be learning from those mistakes. And us as Black people have to continue to educate ourselves on those issues and say that these are not one-offs. These are not just instances that happen once, but these are continual health disparities. I also like that we talked about health equity. It has to be more in the conversation. We talk a lot about police brutality. We talk a lot about policy, and what that looks like in health is something that I think the conversation needs to be more around. I think young people are doing a great job of making noise and creating change around issues, especially police brutality, but also what that looks like in terms of mental health. I think it's coming back into the conversation, especially around the recent incident in Pennsylvania, where police are responding to mental health issues and they're ending in fatal deaths. And so we have to talk a lot about health and how that impacts our communities. And so it's going to take college students to kind of step outside of that academic realm and say, okay, how do I take what I'm learning in school and also apply it to what's going on in my life outside of this college campus? Because college campuses can definitely be a bubble. And so in addition, like Dr. Shepard said, you know, even for physicians, being 5% of the population of physicians, yet 14 to 15% of this population, we have to dream bigger. And we have to understand you have an opportunity to be that doctor, that physician, that healthcare professional, if that's what you're interested in going into, and that it doesn't have to be a dream, it can be a reality. And maybe, you know, seeing, you know, both doctors on our panel today, or even seeing Andre as a PhD student and a practicing social worker can be understanding that that dream can be a possibility. And also I'm speaking as someone who isn't interested in healthcare and isn't going into healthcare, but I would love to have a physician that is Black. And then, you know, my last thing is definitely around voting. How we create that equity is voting. Right now in Texas, early voting ends on October 30th. And then of course, election day is November 3rd. And how you create some of that change is to vote. You know, sometimes we talk about taking the protest to the polls. That's definitely what this instance is right now. There is so much that goes on the ballot. We talk about voting down the ballot. This election is not just about the presidency. It is about so much more. It's about the next generation that's going to be impacted by the decisions that we make by the people in those rooms. Oftentimes how I explain to my younger peers, especially those who have just turned 18, is you are voting on those people who are going to sit in rooms that you will never hear the conversations of, but you will have to live the outcomes of. And so ensuring that when it comes to health equity, that you're voting for people who have your best interest at heart and have a plan for what your health will look like in the future.
Oh, that was amazing. I completely and wholeheartedly agree. I want to bring back our panel along with Siobhan, because we're opening up the floor to our audience questions. We have a little Q&A going on, guys. Aren't we excited? I'm excited. So, first question, where do we send our loved ones to find the right therapist for them?
Is that open to anyone?
Well, anyone, yeah, if they'd like to jump in, go for it.
uh, I'm sure Dr. Shepherd would like to chime in, but there are several resources you can use to find a therapist for your loved one. Uh, I'm sure Dr. Shepherd would probably run it, but for me, I think it's more about the person, what they're going through, and basically what they're looking for, and not to use popular culture. But there's a TV show that's on right now. He's a black male, one of the characters, and he terminated the relationship with his white therapist because he said, "I am looking for." Well, I need someone that looks like me in order to help me. So it really depends on what you're looking for. As social workers, we have several resources that we use to send people to find a therapist. Psychology Today has one. Blackdoctor.org has one, if I'm not mistaken, still up and running. And then I actually have a group on Facebook and Twitter and Instagram called Black Men in Social Work, not to do a shameless plug, but we do have social workers that have their licenses who are practicing therapy. And so if you're looking specifically for Black men who look like you, that is also a place that you could go. But for a blanketed statement, I really would say that's a broad question because it really depends on what the person is going through, their needs. Unfortunately, in our country and our society, their insurance coverage. So there's really not one answer that will fit all.
Dr. Shepherd?
Yeah, I feel like Andre was trying to take over your job and point the questions. I'll just say this. I agree, with what he said. But let me tell you, just like we go and ask for referrals from our friends, we need to start there. Um, if you're looking for a good painter, you just don't hopefully just Google the person. You go ask somebody who you see had a good paint job. Um, I would start there. Uh, Many people have a therapist. People just ashamed to say it. And so you ask somebody in your family, ask somebody in your organization, your church. I guarantee you there is somebody out there who has a therapist, and that's where I would start at first. I believe that Andre has hit on some of the organizations. I would also, since I am the president of the Black Mental Health Alliance, that is not a shameless plug. I say that proudly. I have no problem with that. Black Mental Health Alliance. And so if you want to go ahead and hit us up, we would actually be privileged to help you to find a person of color. And let me just say this too, and I am done. Just because a person is of color doesn't mean that they can treat a Black person. I want to be clear on that. I have gone to some Black professionals and they just don't get it. And so we have to keep an open mind. We cannot be so closed-minded that we say, well, we have to have a Black therapist. Some of the best people who I have worked with are folks from different ethnicities and cultures and have helped the Black people who I sent to them. And so I just want to put that out there also.
No, that's an important point to mention. I mean, mental health is about not just getting better, but basically saving your own life by seeking this help. So that's why it's important, to take that into consideration. Dr. Chin, how do we get a more diverse population to go into medical fields?
Well, before I get there, I want to just follow up on that last point, right? I think there are the right physicians or therapists or physician. Among the good one, they're the right one for you from a patient perspective. And I think what I hope the technology can do is to amplify the capacity and the reach of those right physicians so they can help more people. And I think that's really because there's just not going to be enough of them to go around, which then get to your point, the question you asked me, how do we get more diverse people of diversity to join the medical field, particularly in subspecialty like mental health and primary care and so on. I think there's no one answer. I'm not sure there's enough time here to go through, what we have to do to make that happen. But I think first and foremost is, a point that Andre actually talked about earlier is the community recognizing that there's a role for them to play. And if they're not in it, they can change it. So if you want to contribute and help narrow the gaps, the disparity, in healthcare services, then I think we need more people of color and Black physicians. That means they have to be inspired to go into that field. So it's the same conversation that Andre talked about earlier, that is education to make them realize that the way they can make a change is by doing it. I think Sharon made a great point, and I tell my own kids and other, young people in the field is that sometimes you look at this and you feel like there are 100,000 things that's wrong with the system, and there are probably 100,000 things that we can say is wrong with our healthcare system. But you got to start with something that you can do and pick that up, whether it is to swap and donate and register, or go to medical school and go into training or social work, whatever it is you choose to do, or you can do a computer. Hey, I'm going to put a plug here. I'm not a computer scientist, but if you are learning about coding, great applications. How do you take that? And instead of spending your time, and this is not meant to be negative, but instead of writing a gaming, program with your coding skill, you can use that skill to develop technology that can help physicians amplify and deliver care in a way that's more patient-centric. So there are something you can do. The important thing, Shawan, as you said to the college students, is do something. Don't just think about it, and just don't think about the enormity of the problem, because you'll be paralyzed. There are 100,000 things that's wrong, but you got to start somewhere.
Right.
That is very true. I want to pivot to Jay. Can you tell us how we can join the registry?
Yeah, absolutely. Before I do that, I just wanted to echo the words of Walter Bond, the former NBA player. He was with us the other night on another town hall, and his advice to the audience: never be a spectator, always be a participant, and be an impact player. And I've been thinking a lot about that. The fact is that 75% of people from Black or multiracial backgrounds can't find a match for the treatment that can save their life. They don't have an equal opportunity for a cure. That means that there are more people than I can imagine going into consultation rooms with doctors at cancer centers who are telling them that they have these horrible diseases, but that there's a cure for the disease, and then in the same breath telling them that they can't have that cure because of their background. And we have to change that. We absolutely have to change that. We have to democratize the process so that it's equal for everybody. To join, just to answer your question, is really just a simple cheek swab. And it's very easy to do. Typically in a non-COVID time, we run thousands of donor drives every year. We go to college campuses, and we go to public places all over the country to encourage people to do the cheek swab and join the registry. Today, because of COVID, obviously we're not doing that, but we are encouraging people to go to our website, which is giftoflife.org. Click the button to join the registry. Fill out the form. We will send the swab to their home. They do it in private in their living room. They put it back in the envelope and they send it off to the lab, and it gets tested and they join the registry. But I'm not sure that people fully understand just how simple it is to save a life. There are a lot of misconceptions out there about the donation process. And that's in large part because Hollywood has done an outstanding job, unfortunately, at over dramatizing the process, making it sound very scary, very painful. And really that's what they do for movies and TV. But in reality, to save a life is very far from that. 80% of the time, we're not even talking about taking marrow. 80% of the time, we're taking blood from your arm in a very similar procedure like a platelet donation. Here in our office, we have donors come here every single day to donate their stem cells. And they sit in recliner chairs, they watch Netflix or Hulu, they get fresh baked chocolate chip cookies, and after a couple of hours, they've donated the stem cells to save a life, and they go home knowing that they have done the greatest thing in the world and that they've given the greatest gift that any one human being can give to another, the gift of life.
I greatly appreciate you for breaking down, what actually goes on when you do the swab and you participate in the registry. Like destigmatizing that is like amazing. My last question is for Siobhan. How do we activate college students so they feel part of the solution?
I think you do that by doing what we're doing now. I think a lot of the times with college students, it's a lack of information. But also, I'm going to be honest, you have to synthesize it. They don't want to sit through, unfortunately, an hour town hall. I enjoy them personally. But to be honest, it's giving them that quick information and be able to say, for instance, I really loved how Jay put it and said, it's really simple to save a life. It took him about 5 minutes to explain to us how to swab your mouth and how many lives you can save and how quickly it can happen. And that sometimes it's not that Hollywood dramatized version of it. And to me, I was like, oh, I can swab my cheek tonight. Send me a swab. Can I do it with a cotton? Can I do it with a little Q-tip? Like, how do I do it? And so I think it's a lot about just understanding how to communicate with college students and figuring out what interests them. It's the same thing around voting. What I tell people is when you're trying to entice someone to vote, you have to find out what they're interested in. In this case, if you're trying to get me to swab my cheek, just tell me I can save a life. And I'm be like, oh, I want to help people. That is my biggest thing. I want to be helpful. If you tell me I can save 5 lives today, I will swab both of my cheeks. Great. But for some people, it's understanding, maybe they have a family member who has been on the list before, or maybe it's a trait that runs in their family, but being able to relate to them and say, hey, this is why it's important. And so I think we have to kind of think back and say, okay, how do I get this to a college student in a way that they'll understand? Granted, we're not little kids, but also understanding we don't need the necessarily hour-long, saying we as if I didn't just graduate, but the hour-long explanation of what that looks like, but being able to just give them that elevator pitch that you kind of teach them when they're going for a job interview. What is the elevator pitch to get me to understand why I need to be on the registry to help save someone's life? And I think, like Jay said, I love the quote around being a participant rather than a spectator. And so it's latching them onto that with an elevator pitch to get them to understand that.
That's amazing. Before we close out, I just want to touch on some of the key takeaways. Like, this is such an amazing conversation that we've been having this evening. All right. And some of the takeaways are just, we want to be aware, we want to have this awareness around these issues and how we need to address healthcare disparities. We need to realize the reasons for poor health outcomes in vulnerable communities, whether it's the mistrust to racism, to lack of resources. We need to be aware of those and how we need to be connected on how we can educate ourselves and engage with the public around it and healthcare practitioners in order to help improve those outcomes. And we also need to understand the transformative results that can be achieved through simple action, like doing the cheek swab. So I want to thank everyone for being part of the panel today. It was amazing to have this conversation with you all around health disparities and people of color communities. It was great to have this conversation with Gift of Life, and thank you for allowing me to be part of it. Thank you, everyone, and have a good night.
Thank you. Good night.